Speaking at the launch of Antimicrobial Resistant Multi-Partner Trust Fund was the Minister of Health, Honorable Kwaku Agyeman Manu, said that the government of Ghana has remained committed to tackling health challenges, including the fight against infectious diseases, and has put in measures to ensure universal health coverage for its citizens.
Tackling health challenges, including the fight against infectious diseases, has put in measures to ensure universal health coverage for its citizens. Key amongst the government's efforts to ensure UHC is the provision of primary health care, access to safe, effective, and efficacious essential medicines, including antimicrobials, provision of health insurance, and implementation of food security and biosecurity measures, to mention a few. The AMR National Action Plan objectives aligns with the Global Action Plan on AMR. Improve awareness and understanding of AMR through effective communication, education, training. Strengthen knowledge and evidence base through surveillance and research. Reduce the incidence of infection through effective sanitation, hygiene and infection prevention measures. Optimize the use of antimicrobial agents in humans and animal health. And to develop the economic case for sustainable investment that takes account of the needs of all countries and increase investment in new medicines, diagnostic tools, vaccines, and other interventions. Fortunately, the efforts to combat AMR is a global one. Various organizations are making efforts at implementing interventions to safeguard the effectiveness and protect antimicrobials for future generations. The tripartite, which refers to the FAO, the OIE, and the World Health Organization, not forgetting the environment, is scaling up efforts to support countries to urgently counter this spread through a One Health approach by launching the AMR Multi-Partner Trust Fund. This is an initiative to mitigate the risk of AMR and contribute to the achievement of the Sustainable Development Goals with the following outcomes: reduce levels and slower development of resistance, continued ability to treat infectious diseases with effective and safe antimicrobials, reduce impact of AMR on human and animal health, the environment, and economic development for populations worldwide. This aspiration of the AMR Mptf is to ensure commitment to the principles of One Health, which are communication, coordination, collaboration, in a holistic manner across human, animal, and environmental health in curbing the threat of AMR. This aspiration is a backbone to Ghana's National Action Plan on antimicrobial use and resistance. The One Health approach is critical because actions in the plant sector and the environment affect the animal sector, which in turn has a link with human health and vice versa. I am pleased once again to say that Ghana is currently a successful grantee of the AMR Mptf, and the funds will be geared towards implementation of activities under the National Action Plan, which is in line with the objectives of the AMR Mptf. Madam Chair, I am appealing to other implementing ministries and agencies to mainstream National Action Plan activities in their work plans and put some budget to it, especially those that relate to the National Action Plan. I've been pushing my ministry and the directors to try to implement this policy without even funding, because I could see the activities that are outlined in the plan. Some of them wouldn't need so much money outside our normal budgets. And I will urge other ministries who are our partners in this field to try to see how best they can allocate some little portions of their budgets to try to do certain activities for AMR. But this is a very critical thing across the globe. All of us try to make efforts to work in the area for our own benefit. All our efforts in controlling AMR will be in vain if our regulators are not fully on board. I therefore call on the regulators, especially the FDA, the Pharmacy Council, Traditional Alternative Medicines Council, Health Facility and Regulatory Authority, to crack the whip on unregulated access and practices of medicines use, and more especially Asian parts of those of us who consume medicines, those who use medicines. Some instances, people go to pharmacy shops, they ask them of prescriptions they don't have. They tell them these are prescriptions only medicines we cannot dispense. Clients get angry. They walk out to the next pharmacy shop, buy the prescriptions, and they bring it back to them and say, seriously, what we should do. One the lady who talked about the poetry speaking, I was sitting down quietly. Yes, I come from Oman. I also have, I won't say large poultry, some little medium size poultry, close to about 60,000 beds. And this is Hip Sunyani first. All farms were identified. I have a location in Sunyani. I started taking prevention actions on the farm. I called my boys. Luckily, I haven't got anything there yet. But in Doma, he could have 2 locations. One place got infected. Was close to about 500 beds. But that is just a small portion. Somebody has about 20,000 beds, 2,000 beds, how many thousand beds, all within the Doma. But I've engaged the Minister for Agric. He has actually started working. He submitted some budgets to try to combat. I'm going to give approval. Our disbursement seems to have delayed. I believe soon some little support will come. Or he tells me that because of our own, let me use the harsh word, dishonest behavior, the veterinarians and the ministry will not accept support anybody who comes with his own or her own statistics of mortalities. If you call in the veterinary people to kill your birds and they go and destroy them, they will give numbers, and that is what they can rely on to avoid unnecessary audit queries. So when these things happen, get in the veterinary people. They are all across the country. Every district seems to have a veterinary office. Let them go and inspect and see what you are seeing. I think I have the singular honor to hereby declare Ghana Antimicrobial Resistance Multi-Party Trust Fund project duly launched.
Also speaking at the event was the representative for the World Health Organization, Dr. Innocent Norwegia, said, according to the Globe Action Plan launched by WHO in 2015 to combat AMR around the world, which required the neighbor countries to develop the fight against AMR with the voices that has embraced the concept of one earth that recognizes the independence of humans, animals, and environment.
Plans to combat AMR. These policies are to embrace the concept of One Health, which recognizes the interdependence of humans, animals, and the environment, and the risk of infection transmission between them. That WHO and the tripartite colleagues played a vital role while the country was developing the policy document and the plan. In addition, the World Health Organization continues to provide support to Ghana on the issues of AMR through projects such as the AMR Structured Operational Training, Research Training Initiative, or the SOT-IT, the ESBL Tricycle Surveillance Program, the yearly celebration of the World Antimicrobial Awareness Week.
According to the Director, Technical Coordination, Dr. Mrs. Mata Gyansa, stated that since the World Health Assembly adopted the AMR resolution in 2015, there has been revolution cross-country to develop their own action plans in order to combat the slow pandemic of antimicrobial in Ghana.
Resolution in 2015 with 5 objectives. That includes surveillance, stewardship, investments, infection prevention and control, and others. The resolution tasks countries to develop their own action plans to combat the slow pandemic of antimicrobial resistance. The United Nations made a political declaration on AMR in 2016 with the establishment of the Interagency Coordination Group in 2017, which I was glad to serve. The report of the IACD, who worked for 2 years, highlighted governance and leadership as a strategic arm and proffered priorities to the 5 thematic areas in the Global Action Plan and encouraged a tripartite secretariat that supports implementation of national action plans. Ghana's antimicrobial resistance platform provided the impetus for the development of a national policy as well as a national action plan. And this was done in the spirit of One Health. The multi-trust fund being launched today seeks to address in truly One Health that inadequate funding gaps that we see in implementation of national action plans. The AMS Secretariat with focal points from the tripartite and implementing ministries participating in the development process. The Ghana AMR platform provided technical as well as support letter which enhanced the success of the application. I also urge governments to support innovative financial partnerships with the private sector to protect promising products, including herbal medicines, in the pipeline.